Knee replacements are performed millions of times around the world each year, thanks to their consistent ability to improve knee pain and function. But how can you tell if you need a knee replacement? Well, the answer is, you don't. That's right, you don't need a knee replacement. But you may benefit from a knee replacement, and it may even change your life. How to determine if a knee replacement may help you is exactly what I'll be covering in the next few minutes. By the end of this video, you'll understand the exact thought process that I use and discuss with my patients when trying to determine if a knee replacement is right for them. If you're new to the channel, I'm Dr. Bounajem. My patients often call me Dr. B, and I'm a board-certified orthopedic surgeon. After residency, I completed extra fellowship training in hip and knee replacements at Harvard Medical School. Helping patients with their knee problems and performing knee replacements are a huge part of what I do for a living. And I know that the decision to move forward with a knee replacement is sometimes not that clear. My goal today is to help shed some light on that. First, a bit of a disclaimer. What I was saying earlier about not needing a knee replacement may seem like semantics, but I think it's an important point. As a patient, you should feel empowered with the choice of whether or not to proceed with surgery. There are definitely many patients who would benefit from having a knee replacement, but even these patients still have a choice in the matter of whether they proceed or not, which is why it isn't really fair to say that they need it. There are circumstances that we'll get into later that may make patients feel like they don't have a choice, but no patient should feel forced or pressured into a surgery that they just don't want. With that in mind, the first factor to consider when determining if surgery may be right for you is the diagnosis itself. Osteoarthritis is by far the most common diagnosis that knee replacements are performed for, but osteoarthritis can be categorized into different stages depending on how severe it is. X-rays are the primary type of imaging that we surgeons use to determine if arthritis is present in the first place, as well as how severe it is. Occasionally, we may order other types of imaging as well, but X-rays are more than enough to make the diagnosis the vast majority of the time. The main things we look out for on X-ray are how narrow the joint space is, how many or how large the osteophytes or bone spurs are, and how significant any joint deformity may be. Patients with severe arthritis are generally better candidates for knee replacement because these patients are much more likely to experience significant improvement in their symptoms after surgery. Patients with less severe arthritis are actually less likely to make significant improvements after knee replacement. We generally try and avoid replacing joints that aren't severely damaged because on top of the surgery perhaps not being necessary in the first place, these patients may be no better or possibly even worse after the surgery. Let's break the X-ray evaluation down step by step. This is an X-ray of a patient without any significant arthritis. The joint spaces are nice and wide open, which tells us that the cartilage is largely still there, and this is definitely a good thing. There also aren't any noticeable osteophytes or bone spurs at the ends of the bone. The knee has appropriate alignment, meaning that this patient has no significant deformity of their knee. The lack of clear arthritis on X-rays means that this patient is likely not a good candidate for knee replacement, since the main reason to proceed with surgery in the first place is if the cartilage and bone ends are so damaged that removing and replacing them is really the only feasible option. If this patient is having knee pain, it's very likely that their pain can be effectively treated without needing a knee replacement. On the other hand, here's an X-ray of a patient with severe arthritis. The joint space is significantly narrowed, meaning the cartilage in these areas has worn away. There are also several osteophytes throughout the joint, and if we zoom out again, we can see that the knee is no longer appropriately aligned. The loss of cartilage and remodeling of the bone has caused a bow-legged or varus deformity. This patient has advanced or severe arthritis and is a better candidate for knee replacement than the last patient on the grounds of the severity of arthritis alone. Arthritis severity is a massive part in determining if a knee replacement can help, but the next factor is just as important, and that is the severity of knee symptoms and their effect on quality of life. Knee arthritis frequently causes pain that is sharp, aching, or stabbing in quality, and it usually gets worse with physical activity. For example, standing and walking, especially for long periods of time, can exacerbate the pain and make long periods of activity difficult. Lateral movements and pivoting on the knee tend to hurt too. Going up or down stairs, walking on inclines or declines, and navigating uneven ground are just generally challenging and painful. In severe cases of arthritis, sometimes even minimal activity like standing up from a seated position or taking just a few steps can cause excruciating pain. Arthritis can also cause the knee to feel unstable, and the knee can give out on you, increasing the risk of a fall. People with knee arthritis can feel like they just don't trust their knee. As the knee begins to feel more painful and unstable, you may find it necessary to use a cane, a walker, or even a wheelchair just to get around. Now, if you have knee arthritis and your pain is minor and your mobility isn't really affected, then you may not have much to gain from having your knee replaced. On the other hand, if your pain is so severe that it consistently gets in the way of what you want to do and need to do, then you may benefit a lot from having a knee replacement. Ultimately, it just depends on how your symptoms are affecting your quality of life. An important point to remember is that, believe it or not, sometimes pain in the knee area can actually be coming from a source outside of the knee. For example, some patients with hip problems may feel a substantial portion of their pain in the knee instead, and this is a concept called referred pain. Another example is nerve compression that can occur in the spine, which can cause pain in the leg and possibly around the knee, even without causing back pain at the same time. The best way to make sure that your knee pain is actually coming from your knee is to see a qualified healthcare professional who can make that determination based on your symptoms and the physical exam that they perform. So let's recap. We've talked about how severe the arthritis is and how severe the symptoms are, but we're still missing a huge part of the picture before we can determine if a knee replacement should be considered. We have to also consider what treatment options have already been tried. There are many non-surgical treatment options for knee arthritis that are supported by scientific studies. Treatment strategies with the highest level of support include things like Tylenol and anti-inflammatory medications, physical therapy and exercise programs, braces to help support the knee and improve knee alignment, and injections like steroid injections to help reduce inflammation in the knee. Patients who are overweight can also benefit from weight loss to reduce the chronic stress placed on the knee. This isn't a comprehensive list of what can help, but these treatments have the most published evidence showing that they can help pain from knee arthritis. Individual patients often respond better to some of these treatments than others, but often the most effective strategy is to use multiple treatments at once. For example, rather than just doing an injection or just doing physical therapy, patients will often get the most relief by combining an injection with physical therapy. Remember, always talk to your healthcare provider before trying these treatments, because everyone's different and these treatments aren't always right for everyone. An important fact that all these non-surgical options have in common is that while they can help improve pain from arthritis, they don't get rid of the arthritis itself. While many of these treatments may be effective, they may also be temporary. In general, the more severe the arthritis, the lower likelihood that these treatments will provide a significant or long-lasting improvement in pain. As a result, it's good to have reasonable expectations about how much relief you hope to experience from these non-surgical strategies based on how severe your arthritis is. That being said, if you experience significant improvements in your pain and function with some of these non-surgical treatments, there generally isn't a big downside to avoiding knee replacement, even if your arthritis is severe. A really important point here is that different people experience different amounts of pain from arthritis. And if you're one of the fortunate ones who don't really have that much pain or limitations in your mobility from your arthritis, you generally don't have to have surgery. On the other hand, if you've tried most of these options and continue to have pain and mobility issues that affect your quality of life, surgery may be right for you. Keep in mind that while these factors are very important in determining if someone may benefit from a knee replacement, they still aren't the only factors to consider. For example, ongoing medical issues like heart problems or uncontrolled diabetes may rule surgery out as an option. Depending on what medical conditions you may have, your surgeon may recommend seeking specialist care, like with a cardiologist or pulmonologist, to optimize your medical conditions before surgery. It's also routine for your surgeon to seek communication with your primary care provider before proceeding with surgery. Finally, it's important to consider each patient's baseline levels of mobility, as well as their goals and expectations from treatment. Even though I saved this point for last, I cannot emphasize just how important it is. Even though millions of people get knee replacements every year and we call the surgery by the same name, the kinds of patients that get the surgery vary widely. What I mean is that some patients are in their 40s and some are in their 90s. Some take no medications and some take over 20. And some are used to walking over 15,000 steps per day, and some haven't walked without a walker in years. Even though all these patients get a surgery that goes by the same name, the results after surgery can be highly variable. There are many reasons why this is true, but one of them is that no two patients are exactly alike. This can have a huge impact on the level of function that you can expect after surgery. Many patients achieve a very high level of function after surgery. But the truth is, some do not. While no surgeon can make guarantees, we can make our best estimate based on what we know. So don't be afraid to ask your surgeon what is realistic in terms of mobility and activity after surgery. And now you know 5 of the most important factors I use when talking to my patients about knee replacements. Each of these factors are helpful, but in combination, they're even more insightful. For example, if someone has very advanced arthritis, but they haven't tried many treatment options and their quality of life isn't really affected much, they may not need surgery. However, if a patient has advanced arthritis and has tried virtually all non-surgical treatment options, and their quality of life is still significantly affected by their knee problems, they're much more likely to benefit from having a knee replacement. The bottom line is, if you think knee replacement is right for you, you should talk to your surgeon to see if they think you're a good candidate based on your medical history and other unique circumstances. If you'd like more information on what a knee replacement even is, I'll link my video on that topic right here. On the other hand, if you think knee replacement isn't the way to go right now, but are interested in alternative treatments for knee arthritis, I'll link my video on that topic here as well. Leave me a comment down below to tell me what you'd like a video about in the future. Stay well, and I'll see you in the next video.